Colin Askey, thank you so much for being here at helping us celebrate the 10th anniversary of the Milton Film Festival. Uh,
Thanks for
it's
having me.
it's a real pleasure. It's uh, in many ways a gut wrenching film. I just watched it again before we came on to do the interview here, and I found a lot more heart and humanity in it the second time. I think once you get over the shock of some of what is unfolding, and just the life that people are forced to live on the downtown east side of Vancouver. But once you get over that and start to see the people be these people more and see the humanity, it's quite an affecting film. Uh, you've done so many interviews and shown the movie in so many places, particularly in the United States. And I'm wondering how they've reacted to it down there, where so much of this stuff is criminalized, and there isn't a lot of. You could tell me differently, but there doesn't seem to be a whole lot of debate about decriminalizing it. So, how's the reaction been?
Yeah, I mean, so we're just getting started here in the U.S. and we premiered in New York, where this idea is starting to take fold here. We have the first two public sites in the U.S. that just opened over a year ago, and my wife works there actually. So I've been very involved in that and being able to see that happen, and it's been beautiful. But it's also still illegal and technically federally illegal. So that means that they're struggling to get, city or state funding. They were hoping to get funding from the opioid disbursement funds, which seems to make perfect sense, but they're just really having a tough time with the legality of it, as you said. And I think, yeah, and we had one. We've just started these pop-up screenings through PBS here, and we were in a Q&A last night, and a lot of those folks, it was out in Tacoma, Washington, and this idea was completely new to them. But I also felt like surprisingly people got it, and I think for years in the U.S. They've just been doubling down on criminalizing and punishing and trying the same thing, expecting different results. And as we've seen here, it's now over 100,000 deaths a year from overdoses we're seeing, and what they've been doing hasn't been working. So I think like the lid is popped and people are peeking out. And this film is kind of like being baptized by fire, I think, for people, like for harm reduction and for how these services work. And so it's a bit of a shock, but it's also, I think it's better to see it, as you're saying. You saw the humanity and the love, and having myself worked at these sites in Vancouver, that's what my hope was, is that yes, we see a horrific crisis and a tragic amount of death in the community, but we also see the beauty and the humanity and the courage of a community that lots of people think don't have much to offer, and especially people who are using drugs, like Dana, who's an injection drug user, and people think that these people are written off and will rob your grandmother or kill your kids and stuff, and we see a guy that's just a decent human being who is saving lives every day and doing more for his community than I think most of us do. So it's tough to argue with, I think, once you're able to actually see that. And I appreciate the willingness for people and the interest, because I think we as a society really need to change our perspectives on how we view this issue.
Well, it seems as though that the fentanyl has changed a lot of attitudes toward drug use. That people really do see it as a scary thing. It's not just heroin, which most people aren't familiar with, but fentanyl is right out there, and I get the impression it's really scared a lot, as well as doing a lot of harm. Obviously, it's also scared a lot of people.
Yeah, I mean,
This has entered the middle class now more than, I don't know, heroin use used to, and that sort of thing.
exactly. Yeah. So yeah, fentanyl is definitely affecting lots of different drugs, and some drugs that are less stigmatized, and which is used more from middle class and party drugs, is so people are becoming more aware of um, that it's dangerous out there, and we need to uh, not just say no to drugs. I think that we've been trying to do that for years, and obviously that's not working. So I think more people are saying, hey, maybe we need to talk about this differently, and especially when our kids could be affected by this.
Exactly.
Yeah.
Now, so now this is going to sound like a very, speaking of the middle class, this is going to sound like a very middle class guy of a certain age question. But with all, when the whole drug thing started in the 70s, and particularly I remember cocaine. Cocaine was always sort of the party drug, was kind of an aphrodisiac. It wasn't going to do anybody any harm. And it was, there was a fair amount of uh, just lack of knowledge about the harm the drug could do. It is so many years later now, and I was interested in one of the participants in the film said that he kind of knew that fentanyl wasn't a good thing to do, but he really didn't know one way or the other. Um, there's so much information out there now. So many people know that this is not only harmful, but it can kill you. Um, Yet it doesn't seem to be making much of a difference, does it?
Yeah, well, I think people use drugs for many different reasons, and it's really an individual thing. I think I know personally people that are able to use drugs and are very successful and very a lot smarter than I am, and a lot of people it affects badly. But I think also that it's a complicated issue, and I think when we look at something like the downtown east side, or communities that have faced numerous challenges, or communities that face extreme poverty, such as the downtown east side, um, it's it, a lot of people have been through a lot, and to assume that someone should just be able to stop, or just
Or not start, I
not
suppose.
start, yeah, is very, we it's like projecting our values onto someone else, and our lives, and we, I think, need to be understanding that lots of different people have lots of different experiences, and along with that comes a lot of trauma, and historical trauma. I think they did a study in the 90s in the downtown east side, and it was I think something like 90% of those that were a part of the study had experienced sexual abuse.
Huh.
So I think the reasons that people are using, it's pretty deep, and so it's one thing. It was one thing, just to tell people to go to treatment years ago with heroin. I mean, it was a dismal failure if you would measure it against any other kind of health intervention, about in terms of the percentage of people that actually got into recovery from treatment and were able to maintain sobriety on some level. It was that difficult back then, let alone now that there's fentanyl. It's that much harder to detox, and that much um, more addictive and stuff. So I think just we have to have different options for people, and have more understanding, and not just say, no, you can't do that, and if you're going to continue to do that, we're not going to offer you anything,
Right, right.
and that means
Uh,
death in this day and age.
do uh, do people get off? I mean, again, it's going to sound like a naive question, but do people shake the habit? Do people get off fentanyl?
I'm
Is,
sure. Yeah, I'm sure there's numerous examples of this, but I think, like, when we're looking at a community like the downtown east side, it's a high percentage of injection drug users, and crack and meth users, which fentanyl is pretty consistent in those as well in that neighborhood. Um, it's there's success, if is measured for very differently for each individual, right? So sometimes when someone has been homeless and on the street, being able to help them in a way that just brings them in off the street, gets them some food, and maybe can direct them to some housing is like a small step. And so there's lots of different programs now that on a smaller scale that offer
Right.
alternatives like prescription heroin even, and Dilaudid. And I think a lot of those have been successful in reducing the amount of fentanyl, and that makes it a lot easier for folks, and a lot when they're not spending time having to run around and do ask at risk things that might endanger them to get their drugs or get thrown in jail or whatever. They're able to have a lot of benefits in their lives, such as getting relationships back and even going to school, so options like that are working. I think people that have more support systems in place may have a better chance of getting off stuff completely, because they have means. It's one thing to go into a detox or something and come out and still be homeless and still have all the same
Oh,
challenges.
exactly. Yeah.
And another thing for people that may have still family in their lives and a place to live even.
You were a harm reduction worker in Vancouver. Can you tell us a little bit about how you ended up doing that?
Yeah, so I guess I also have my own kind of experience with addiction, and was court ordered into treatment when I was a teenager. And it was an abstinence-based, like 12-step recovery treatment center. And I went on to work there for many years. And I'd moved to Vancouver to go to film school, and was kind of looking for a job, and thought with my experience, it made sense that I looked in the downtown east side. And I ended up working for an organization, that was leading kind of the country and the nation and the North America in harm reduction, including opening Insight. And I really didn't know what it was. So I was pretty new to it, and it kind of blew my mind and really changed my whole perspective about addiction, and about, how it affects people in different communities in a lot of different ways, and that every community and every individual needs different tools. But yeah, I was definitely apprehensive to these services at first, as we're taught that these kind of things could be enabling for people and stuff like that.
Oh yeah, no, it's initially hard to get your head around. I must say that.
Exactly, yeah. But I also saw all the success of it playing out, and I knew rationally, like handing out a sterile syringe to someone, or letting someone use whether I did that or not. Anyone that has been around this issue understands that it's not going to change what that person's going to do, but it does make a difference on whether and how they use it, and whether they can use safely and stay alive.
Safely, yeah.
So eventually, yeah, that's kind of really opened my eyes, and I really not only got to learn a ton from the services and doing that work, but also just the community and the people that live there, and really.
Now, Ron Grigg, who is kind of the star of the film, had been doing it for 10 years, which I found remarkable, and obviously had gotten pretty burned out. Did much the same thing happen to you? Is that why you got out of it?
Yeah, it's funny. It's tough work. And like when I was doing,
yeah.
I was working with Ronnie actually, when we both kind of started around the same time and working at Insight together. And it was definitely tough, but it was also, beautiful. It's just a very extreme emotions, I would say, that you're dealing with and facing every day. And extreme questions about, how our society really works, that you're just pushed in your face daily when you're doing that work. And I was like, I kind of need a break, and I'd moved to Toronto, I remember, for a year and was trying to do film stuff. I was like, okay, I went to film school. I'm gonna, and I was like editing like a cooking show, and I was just like, hey, and I was like, this is so boring. And that's one of the problems with working, because there it's like it's extremely difficult, but it's also it fills your soul up so much. And as Ronnie talks about in the movie, like I think we all in life are really just looking for meaning, and you certainly
Sure.
feel that when you're working down there, and not in a individualistic, arrogant way, but it's really, you feel a part of something, and a part of a community in a way that I've never felt anywhere else, really. So yeah, I remember that. Like after a year, I was like, I got to get back into the downtown east side. But lucky,
That's amazing. That's
yeah,
amazing. You're out of it. Where most people would kind of shake their heads and think, "Thank God I'm out of it," but that you found enough that you wanted to go back.
yeah. And for me, my path back was, at the time, it was when Insight was like in the Supreme Court is when the conservative government was trying to close Insight, and they were in the Supreme Court, and I was asked to film it, and that was kind of like, people started asking me more and more to film stuff, because they wanted to get awareness out there and education and stuff, and that's kind of how I started doing this sort of work, and kind of coming at it from a different way that is a little less tough than Ronnie, and even Ronnie now, he burns out at ops, but he's still doing that work, and
Oh,
he's
is
trying
it? Yeah.
to find different ways as far as like consulting and being available for people that are burning out, and supporting the workers and stuff down there. But I think it's similar to him. It's like he's very much like the folks at ops there. Really, that community is very a beautiful place to be, and it's hard to leave.
Yeah, well, that's amazing. So, having had that experience, I assume that it made it easier to go back in there with a camera and do what you did with the film.
Yeah, I don't think that it would have been possible unless I'd had those long kind of established relationships. Like lots of the folks that are in the film, I've been friends with for years, with Sarah and Norma, and even like guys like Ron, who passes away at the end. I've known and in the neighborhood for years and stuff. So I think that it's obviously a very difficult environment to ask people to be vulnerable and allow me to film, but because of my previous experience, and
Sure.
that
Did anybody say no? Are you kidding? I don't want to
yeah,
be on.
yeah. So and I've filmed in the community for lots before the film, so I kind of know how to navigate the community and the sites like this. And so before I went in it, every day before I would enter any space, I would kind of talk to everyone in there and say, hey, I'm coming in through the camera. Are you comfortable being on the camera or no? And it was always, like you'll see in the film, there's a lot of close-ups, and a lot of that is because I'm avoiding the people that weren't comfortable being on camera. And obviously, that's to be expected. Is no one, I didn't want to be in the way of any sort of services and life-saving services, so was always very careful to make sure that they came first and throughout the process.
Still, it's amazing how people for the film put themselves out there, allowed themselves to be filmed shooting up, and making really heartbreaking stories about their lives that be difficult to talk about at the best of times, let alone on film. So I mean, it's remarkable what you did get.
Yeah, and that was just a huge for the film, and for like the Danas and the Dons to do that, because it's a very intimate and vulnerable moment for them. And that process was it was kind of offered and was never pushed on anyone. And it was always a question too of whether to use that for me, because it is used badly in a lot of media and a lot of stuff as either just as a bad, it's as like a shock for the shock value.
Sure, to exploit the
Yeah, exactly.
situation. Yeah.
Yeah, and I did think it was important though, because I felt like if we're being honest with an audience, um, we have to tell it like it is. And I
Sure.
definitely knew about the beauty, and I knew how amazing people like Dana were, and I wanted to show all the sides of that. And I think it's like, it's one thing to show an audience, okay, here's someone injecting drugs, and you don't have to be comfortable with it. But it's also tough to argue all your preconceived opinions you might have about someone who does that when you also see Dana, speaking at City Hall or saving someone's
Sure.
life.
Yes. Yeah. Um, I always ask a documentary filmmaker this question: uh, how 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 difficult was it to get financing to do this?
Yeah, there was no financing in the beginning. There was just like, for, as I mentioned, the community meant, I just spilled my water, so I'm
Oh,
wiping
I thought
water.
maybe you were petting your cat, which
um,
is certainly understandable.
yeah. So in the beginning for me, it was simply like I had moved to New York, as I mentioned, and was watching from a distance as like people I'd known were passing away. We were getting calls almost weekly, and knowing friends like Sarah and Ronnie who were just going through hell, I just wanted to help in any way I could and shine a light on this beautiful community that was rising up and responding to the crisis when no one else would. So it really wasn't even thinking about funding or even what this would eventually be. I just wanted to start capturing, and
Right.
eventually it was like stories were beginning to unfold, and I was hoping that there would be, interest. And I brought on some producers, Mark and Bob, who had
Yes.
done a CBC doc before, and then we had met, Monica, who works in the US, and then she introduced us kind of the PBS pathway to get funding. And I remember it was just before COVID was hitting, and I had a child on the way, and the US's like maternity leave is not great.
Doesn't exist.
So I was just like, oh my God, what are we gonna do? And then we got this grant, and yeah, it was just like we were saved, and we knew we could make it really, make the movie properly, and that meant a lot. So that really came after all the filming, and a rough cut was in place.
Wow. And how long did you film at the clinic?
It was like on and off for 2 years, I would say, maybe
Oh,
three.
wow.
Yeah.
Uh, uh,
I'll just mention too, like, so when COVID was hit and stuff, there's also a cinematographer, Eric Sanderson, who was amazing, and I'd worked with lots in the neighborhood before too, and so he was a big part of that and part of the filming, and did a lot of it just himself when we were there as well.
so, Colin, having been in and out of the neighborhood, and as you talked earlier, worked in harm reduction and come back and forth, and have now filmed there. Do you see any change at all? Do you see any improvement in the neighborhood? Is any of this having any effect on what people do and people's attitudes and that sort of thing?
Um, as in like the crisis itself, or as in the film?
Yeah, is there still? I mean, I
Yeah.
guess it's a silly question again to say, "Gee, is there still a crisis?" But
Yeah, it's not going away, and so it's a very complicated issue. And I remember, like, and then we look at fentanyl now, and it's like, seems like this horrific crisis, but there was a crisis in the 90s which led to kind of the establishment of Insight, of
right,
people dying and HIV spreading, and it was, the harm reduction services were really introduced into the downtown east side, and we saw the benefits, and it really grow almost to a point where people were like, okay, we're great. And I remember, like, a downtown east side when I left, when the community was all finding these jobs watering plants, and it felt like we had really kind of were going somewhere, and the community was a lot different than it is now. But it wasn't just about fentanyl. I think, like, because of that idea that, okay, there's enough funding now to harm reduction in downtown east side, there was a lot of cuts that were being done right before and like drug user centers that were being shut down. as well as like organizations that were kind of taken out. Yeah, I remember an organization that was trying to kind of get all their buildings stacked with Narcan, and the health authority at the time was like, no, you can't do that, and had removed all of the
Ah,
naloxone. And now it's like being thrown everywhere. Please use that,
yes.
right?
Yeah.
But but
Everybody's urged to carry it around.
yeah, so there was like a lot of kind of factors that when fentanyl hit, that people just were like, they had no it was really playing catch up. And I think that's what we've been doing for years. Like there's a lot of evidence-based and it's talked about in the film, this like this safe supplies, like okay, like we need to understand that not everyone's able to just say, okay, fentanyl's there, I'm going to stop using.
Yeah,
That's a ridiculous way to look at this. We have to accept that these are people that have faced, incredible challenges, that we need to think outside the box to what each individual's path is. And a lot of that, I think, is looking at safer alternatives and being able to provide people with a different sort of supply. And those programs are always just done on such a small scale. Like they exist in Vancouver and they're successful, but it's never enough, right?
yes.
So I last time I was out there was like a tent city down Hastings, and there's just so many issues. There's more and more gentrification, so the community is actually getting smaller, which is a lot part of it, because we see so many people out there now. The visual is like, oh my God. But what people don't see is the gentrification outside of this community that's constantly pushing them in and closer together. And yeah, I mean, people think, oh, this is so much money, but this is a crisis, and how much money was spent in COVID or all these other different things,
Sure.
and I think when we do a small scale study and we see the success, it needs to be expanded appropriately to meet the actual need of this crisis, and that's what we haven't seen. And in the
Well, and
States,
of all the places for this crisis to be occurring, which Vancouver is such a city anymore of haves and have-nots. It has become ridiculously expensive that, and yet you've got this down and out community in the midst of it. So it's to say the least, it's a curious juxtaposition that
absolutely, yeah.
the community
Yeah,
finds itself in.
yeah, that's absolutely the like, as I was mentioning before, kind of these things that you're confronted with on a daily basis when you're working there, and then being able to leave, having the privilege to be able to leave that community as well, and then you see the rest of this extremely wealthy city. Yeah, it's complicated stuff, and that's why I think, like all of these services that we can provide and these tools that we can provide through harm reduction, they can save lives in the here and now. They can show us, new paths of how to treat people with dignity, but it's going to take a whole other level of systemic change to really look at this issue. And I think, the way we viewed drugs as being this, horrible thing, and just say no and just pretending that it's not a reality is led us here. And that's part of the real structural kind of issue that's brought us here. And it's not just about fentanyl. And fentanyl gets, is the boogeyman in the media and stuff, but it's a lot deeper than that. It's about us as a society educating ourselves and looking at different points of view, and other people, especially points of view.
Well, the other thing is there are a lot of people out there selling this stuff to people at risk. As I'm watching this, I'm sure other middle class people like me are wondering the same thing. How are they getting this stuff, and is anybody trying to stop the flow of this stuff to begin with, or should they be trying to stop it? I don't know, but I mean,
Yeah, so fentanyl, is synthetic, and it's made in labs and clandestine labs in Canada, and it's not just, the people assume it's just coming from China, which maybe originally it was, but it's being made everywhere now. And and it's also like been trying to, the war on drugs has been trying to kind of stop the flow of drugs and all this stuff without offering any alternative, and that's it's just a dismal failure. Even when there is these big seizures we see in the media, does it affect the amount of use on the street? Not at all. If we connect those two dots, it never makes a difference. So
it never seems to, does it?
Yeah. So I don't know how many years of evidence we need to say that, okay, this is just stupid. If we had actually offered, government sanctioned alternatives for people, I think it becomes less attractive and less cool when it's medicalized. So there's the prevention side of it, and also for people that are in this facing this issue, there's a way to do it with getting treated with dignity and being able to do it safely and not die. And that leads in those relationships that are built when we offer these services are so crucial into the path beginning to start journey to wherever that means for that person, whether it's recovery and abstinence, or just using less, or just being able to maintain their use so they can work still or do things like Dana. There's lots of different roads that we could be taking if we stopped just allowing. Fentanyl wouldn't exist if we supplied this years ago. Just if we think about that, fentanyl didn't have to be here. There's like the iron law of prohibition that is constantly is drugs will always continue to find ways to be shipped for cheaper and smaller ways and be more potent and more profitable and more stronger, and that means more deadly.
Right.
We rely on a black market. It's constantly, whether there's going to be another fentanyl until we change.
Well, that was going to be my next question. Is there something even more dangerous out there coming down the pipe? That
there always will be until
that's what I'm thinking. Yes,
until we provide it ourselves in a medical and from a whole other. That doesn't even have to be medicalized, but until we offer alternatives, it will always get deadlier and deadlier. And right now, it's not just about more stronger opioids, but it's the stuff that it's cut with when it's made in these labs. There's like xylazine in some places that's, it's eating people's flesh. There's benzos that we see in the film, and it basically knocks people out they pass out for hours and don't know what's happening. And that just makes helping people that much more complicated and difficult. And it would be way cheaper. It's like morally, we just like syringe exchanges when they started, they dramatically reduced HIV and the spread of many diseases, but people were morally opposed to it. So it was controversial, but there was no way to argue with how much it reduced the spread of HIV. And so we had to accept this, and then now no one even thinks about syringe exchanges. It's just part of the way we are,
Right.
Always these small increments of what we're comfortable with. And that's what's killing people, is that's our comfort level, So I think we have to let go of what we think is right and wrong, and actually look at evidence and look at the numerous peer-reviewed studies and research that's available. Because if we look at Switzerland, for example, we don't see the catastrophe that we have in Vancouver, because they've provided drugs for many years, and fentanyl didn't have a market to really enter. So I don't know what more examples we need.
Well, as you keep saying and show so well in the film, you only have to look at what the crisis is on the downtown east side of Vancouver to understand that something ain't working. That's for sure. I presume that you would decriminalize drugs entirely then.
Well, I think like decriminalization again by itself doesn't help. Like it's in the downtown east side, I think it's decriminalized now. But I mean, until there's an alternative, people are still at risk of dying, right? So I think it's like it's like when harm reduction began in Vancouver, there was a 4 pillars approach, which was prevention, enforcement, and it was about getting different sides of and viewpoints and government all working together. And I think that that people want to stick to like this is right or wrong instead of being open to other people's views on this and other things that are working. And so if we look at the evidence and look at treating this from each individual's path and each community is going to be different. Maybe this isn't right for everywhere, but we have to be able to have these options available and look at what's working. So I think decriminalization would be great because it's a healthcare issue. It shouldn't be.
Exactly. Yeah.
Yeah, but that has to come with a lot more alternatives as well, and a lot more supports as well.
So just to start to wind this up, Colin, tell us what drew you to New York.
Well, so my wife was offered a job working for the organization that just opened the first 2 sites in the U.S. here. So that was an opportunity, and we decided to take it, and she loves New York, and I'm stuck here now.
Are you working on another film?
Yeah, so I was because obviously I'm married to my wife. I had the inside scoop on the opening of the sites here, so I was following the process kind of from the early days, and as they were building them, and continue to follow them as they struggle to keep them funded and not get shut down. And hopefully, they don't, because they are technically illegal here. So I'm working on that one, and I'm also working on another documentary in the downtown east side about a woman named Eris Nix, who's a radical kind of activist, awesome, intelligent human that has been buying narcotics from the dark web and the black market, but testing them and making sure that there's no fentanyl in them, and then giving them away at different events and stuff like that. And also now trying to create a store where it's like, this is like a compassion club model, where we're offering you a safe supply that we know and can guarantee is tested, and that you can actually read on the label, warning, this contains cocaine, but this is 100% or 80% this, and this is the cut. And they not only have had no overdose deaths supplying this, but they have had no overdoses at all, because people know the exact amount of what they're using. So it's a fascinating model. And yeah, excited to be. It's a lot of work making these things. It's years and years. So
I applaud you for your diligence in pursuing this stuff, knowing how hard it is to make a documentary, period, let alone the kind of work that you're doing. So, but listen, thank you so much for taking time to talk to us and talk about the film. You certainly opened my eyes a little bit, and I suspect all of us here at the Milton Film Festival have seen the film, or will see the film, will feel the same way. So thank you so much, Colin.
Well, thank you so much for having me. Huge honor to be here, and thank you all so much for coming to watch the film. Really means a lot.
Well, we'll bring the next one back to us, please.
Will do.
Take care.
All right. Thanks, Ron.
Thank you, Colin.
Everyone.